Most people believe that the older you get, the more medical tests you should run. More blood work, more scans, more invasive screening. Say catch it early and save your life, right? But well, what if I told you that after the age of 70, running these exact same routine checkups can actually shorten your life, cause severe complications, and trap you in a spiral of unnecessary surgeries? There's a concept in medicine called overdiagnosis and overtreatment. When you are 40, your body heals quickly and diseases grow relatively faster. But when you are past 70, your body biology changes. Many small abnormalities like a tiny, slow growing tumor or a mild polyp can grow slowly that they will never harm you. However, the tests used to find them and the invasive biopsies or surgeries used to remove them, they carry massive risk of organ damage, severe infection, and loss of independence. So today we are breaking down the 5 routine checkups you should seriously question or stop altogether after age 70. The number one on the list is routine colonoscopies after age 75. Now, don't get me wrong, in your 50s, catching a precancerous polyps in the colon is a huge win, but there is a critical piece of information that most people don't know. It takes roughly 10 to 15 minutes of an average colon polyp to actually turn into dangerous invasive cancer. If you are 78 years old, a microscopic polyp is almost certainly never going to bother you in your lifetime. But look at what will bother you, the prep. To do a colonoscopy, you have to drink strong laxative solutions to completely flush the bowels. In an older body, this severe fluid loss causes 3 major dangers. Number one is the severe dehydration and electrolyte imbalance, which triggers cardiac arrhythmia. Then also it also causes acute kidney injury from the sudden volume depletion and bowel perforation, because aging intestinal walls become thinner and more fragile, increasing the risk that the scope punctures the tissue. So stop routine colonoscopy at 75. If screening is truly needed, use a simple tool test like the FIT instead. So number two is for the men. Routine PSA, which is prostate specific antigen blood screening. This one catches a lot of men off guard because it's just a simple blood draw. How could a blood test be dangerous? Now, as men age, the prostate naturally enlarges. A higher PSA score often just means an enlarged prostate (BPH) or a mild inflammation, not aggressive cancer. Furthermore, autopsy studies shows that nearly 80% of men who reaches the age 80 have prostate cancer cell present in their tissue, yet they die with it, not from it. Is what we call indolent or sleepy tumor. When you run a routine PSA on a 73-year-old, a slightly deviated number panics everyone. What comes next? A transrectal needle biopsy? That means taking 12 to 14 core needle samples through the rectum, bringing a high risk of severe sepsis, infections, and heavy bleeding. And if they treat a harmless tumor with radiation or surgery, the top two side effects are permanent urinary incontinence and erectile dysfunction. So the United States Preventive Services Task Force explicitly give PSA screening after 70 a grade D, meaning do not do it routinely. Then the third test is the routine pap smear and cervical screening in women past age 65. If a woman has had normal pap smear throughout her 40s and her 50s, her risk of developing cervical cancer late in life drop to almost zero. Cervical dysplasia move at a snail pace, yet millions of women over 65 are still scheduled for annual pelvic examination and pap smear out of habit. So in older women, the natural drop in estrogen causes tissues to thin out. It's a condition called vaginal atrophy. This tissue thinning frequently causes false positive result on a pap smear. That false positive forces the patient to uncomfortable follow-up colposcopies and tissue biopsies that cause physical pain, spot bleeding, and immense emotional stress, all for a disease that they almost certainly do not have. So if you have normal screens on your 50s, in your 50s, and or early 60s, major guidelines recommend stopping pap smear completely at the age of 65. Then the fourth is the baseline screening ECG or EKG, electrocardiograms ECG, when you have no heart symptoms. You go in for a general physical and you feel great. You go for walks every day, no chest pain, no shortness of breath. But the clinic runs an ECG just to get a baseline. Here is why this is a trap. An ECG in an older adult almost always shows minor harmless abnormality, a slight conduction delay, an old benign wave shift, or an extra heartbeat. Because the doctor sees an abnormal line on the paper, they are legally and clinically obligated to investigate it. So suddenly, a healthy 72-year-old with zero symptoms is booked for cardiac catheterization, where dye is injected into their arteries. That dye can cause kidney damage, and the catheter carries a risk of stroke or vessel puncture. If you have a chest pain or palpitations, get an ECG immediately. But if you feel great, a routine screening ECG creates rabbit holes that can land you into the ICU. Then number 5 is the routine screening mammography after 75. This is a sensitive subject, but we have to look at the hard data. Mammograms are fantastic at finding tiny calcifications and low-grade tumors like ductal carcinoma in situ. But after the age of 75, many of these small tumors grow slowly that they would never spread or impact life expectancy during a person's natural lifetime. When a mammogram finds one of these slow-growing nodules in a 78-year-old, it sets off a full oncological cascade: invasive needle biopsy, lobectomies, mastectomy, radiation therapies, hormone-blocking medications, which severely weaken bones and cause debilitating fatigue. The treatment itself often inflicts far more damage on an aging body, causing fractures, bone fracture, loss of mobility than the slow-growing tissue would ever have. If life expectancy is under 10 years, or if you would decline aggressive chemotherapy surgery if something was found, stop routine mammogram. Now, let me be very clear. This is not about ignoring your health. If you have symptoms, if you see blood in your stool, if you feel a lump, or have a chest pain, or notice sudden weight loss, you must get evaluated immediately. Diagnostic testing for symptoms is life-saving. What we are talking about today is routine screening on feeling healthy older adults. So take control of your health, focus on your diet, stay active, protect your sleep, and don't let unnecessary tests ruin your golden years. If you found this video helpful, hit that subscribe button, leave a comment below, and I will see you in the next video. Bye for now.